Good evening, everyone. We'll wait like another minute before we get started. All right. Also, please forgive the background noise because my kids are in the background. Oh, my son is feeding the slushing machine. Okay, I am going to share our presentation. All right, good evening, everyone. I'm Rachel Lorenzo. I am the co-executive director at Indigenous Women Rising. I am from the Mescalero Apache tribe and the Pueblo of Laguna, and I'll pass it off to Justin to introduce himself.
Hello, everybody. I'm Justin Lorenzo. I am from the Pueblo of Laguna, and I run our Emergence Fund, which is our fund that helps, I guess, with the realm of birthing. So whether it's a doula support or midwifery support, we're there to help kind of fund so that you can achieve these services. And I guess just a quick a doula is essentially a doula is a kind of a support person that can help you along with your birth. Normally they're in hospital settings, but they could be anywhere. They don't do the actual delivery, but they can support with whatever needs you might have, whether it's emotional questions during the process. So they're just there to make sure that you have a good nice, calm, well, as calm as it can be, birth. And then a midwife is usually licensed, depending on state, but licensed to either have to perform a birth at home, or either they work in a clinic, and they'll have like a birth center, which will have some of the, I guess, some of the medical stuff, things that you'll need. So yeah, and so our fund kind of helps with that. And also it helps with any kind of traditional support you might have, or either it does help with the um, lactation support as well too. And I'll pass it to you.
Yeah. Hello, everyone. My name is Ronnie Lorenzo. I'm from the Laguna Pueblo, and I am the Seneca tribe. And I am the community health coordinator for IWR.
Thanks, Ronnie. And thank you, Justin. Yeah, some of the stuff that Justin talked about, we'll go into just a little bit more detail as the info session goes on. Oops. The history of Indigenous Women Rising. How did we get here? So back in 2013, I just thank you, son. My son made me dinner. Back in 2013, I had an abortion. It was a very much wanted pregnancy, and things didn't go the way that I wanted, and I experienced a lot of um, fat phobia and racism during my ER visit, and it just felt really isolating. It felt really not just isolating, but it felt really scary. When you're in a situation where you're in a lot of pain, you don't have all your wits about you. Plus, Justin and I were really young and not really knowing what our rights are, what the responsibility of the providers are. And so after this experience at the end of 2013, in 2014, I felt like it was time, for me to start having these conversations with other Native women who have had similar experiences and to be able to share these experiences with each other, not only in a safe setting, but also in a setting where we don't have to censor ourselves or we don't have to feel conscious about knowing all of the social justice jargon and just wanting to make sure that everyone felt supported. And so over the last 11 years has been a lot of growth and learning more and more about how to organize, how to create relationships with our federal delegation, with the state legislators and different agencies, and educating our community about what our rights are as Native people seeking healthcare. And these incredible pictures, this one right here is at Laguna Feast in September of last year in 2024. Our co-ED Shane, our community engagement manager, Cookie, me, Ronnie, our comms manager, Marcus, Justin, and our son, Jude. And then these are some previous staff. This is one of the first tabling events we ever did. And we did a project where we reimagined what our traditional regalia might look like if it was more breastfeeding friendly. So we were really proud to show that off. And then this picture was from Norway last year. Indigenous Women Rising has gone international, and so we've been able to travel the world and talk about our vision for not just reproductive justice, but also reproductive sovereignty and what that all entails. I wanted to share just really briefly what our values are. They are our cultural cornerstones, and they are not negotiable. Always and forever, we're going to be Indigenous centered. There are very few, if any, organizations in the country that are Indigenous centered and Indigenous led, and talking about sexual health. And I'm really proud of what we've done and how far we've come. Accountability, not just to each other, but to our communities, integrity, empathy, support, respect, responsibility, and empowerment. I really want to touch on empowerment really briefly because we really want to take the knowledge that we gather and the stories that we share and empower others to share their stories in a way that feels good for them, and take the knowledge that we're sharing and apply it to their own lives and share that knowledge with the young people in their lives. Yeah, just empowering each other to make thoughtful decisions about their own sexual health. Trust. We believe in moving at the speed of trust. It can take years and years to build trust with community members, tribal leaders, state agencies, elected officials, and of course with each other. And being in community is a verb, and community as a noun. We want to make sure that we're acknowledging that we are also community members and that we're treating each other in a good way as relatives. Our purpose statement, I'm really, really proud of this statement because it wasn't just me as a founder that came up with this statement. The statement was created in collaboration with folks from Navajo Nation, Zuni Pueblo, Laguna, Mescalero, Chiricahua. So this was a community effort. IWR is committed to honoring Native and Indigenous people's inherent right to equitable and culturally safe health options through accessible health, education, resources, and advocacy. And I will turn it over to Justin to talk about the Emergence Fund.
Cool, thank you. Yeah, so yeah, again, I guess going through with our Emergence Fund, yeah, just like what's the need for it? Why did we create it? So back in essentially, well, back in the pandemic, there's a lot of things going on. One of them during this time was during 2020, when we were dealing with the virus, Loveless Women's Hospital, they put out a racist policy that in place that said that if pregnant Native woman came in and she had the same zip code as one associate to a reservation, she will be flagged for quarantine and separated from her baby. This is part of a long history of Western medical world making Indigenous people out to be carriers of the disease. And so with that, we mobilized thousands of people to send comments to the hospital about its racism. And so yeah, that was a initial step into the birthing realm and how racist stereotypes still carry on today. And then also with that, health concerns and outcomes, as a lot of people in the field know, Native and Black communities in the U.S. face some of the highest rates of maternal and infant mortality, which have increased since the late 1900s and century. I mean, due to forced hospital births um, and outlaw traditions. We can go into it a lot deeper with the turn of I guess as we went into a more medical Western medicine kind of took it out. So Native women are 4.9% more likely to die from pregnancy related issues than white women, and Native babies are 9.1 more times more likely to die before their first birthday, and over 80% of the pregnancy related deaths in the U.S. are categorized as preventable. And so, yeah, just so with that, those high numbers, we really want to emphasize the um, the struggles that our communities face. And also, another struggle is postpartum depression. One of the contributing factors for they shorten it down to PPD is generational trauma and the history of Native people being forced by the federal government to stop our traditional birthing practices. The national average of PPD is 11%, and the Native people's rate of PPD ranges from 14 to 29%. The fact that Native people's rates of PPD are not certain is an example of researchers not considering our communities because too often we are statistically insignificant. And I mean, yeah, gestational diabetes. There are high rates of gestational diabetes in our communities due to a variety of factors, including food insecurity. Healthy foods many times is financially out of reach for many families. Another factor can be a lack of access to prenatal care and general health care before pregnancy. And so with this fund, we hoping to attack some of those and just bring awareness to these things. And of course, geographical barriers. Whether we're in a rural or urban natives, we may still have difficulty actually accessing healthcare due to physical locations, lack of public transportation, or either lack of childcare. And unfortunately, those who do work in the service industry may not have the ability to take time off work to get the provided recommended like checkups or whatnot. And another thing that is a representation in studies. Um, as mentioned earlier, it directly impacts our community's health when we're not represented in national studies. We are highly encouraging those of you who aren't familiar with data sovereignty or community-based research to learn more about it. Part of what we do is gather our own data and make sure that our clients know that they have control of what they share with us and know that we can use the data for and what we use the data for. And consent isn't just for sex, it's also for ensuring our communities are safe. And then, yeah, just midwifery and doula care are traditional. one of the goals of this fund is to not to tell people what is traditional for them, but to ensure that people can connect to their own culture and traditions if they want to, and we know that we can help with the financial support needed to make that happen for them. Yeah. So yeah, so with this fund, with the fund, hopefully we hope to cover midwifery care, as I talked about earlier. Midwifery care is normally it's care that you can midwifery care is normally either what you would refer to as home births. So when you think about like having births in the water tubs or whatnot, or even they also do it in clinical they have clinics for it too, where they have a building set aside for having births. So it's separate than what a hospital would be. It's more focused on giving birth. And normally with midwifery, they take classes and there's different certifications. Different states have different criterias for how they get these licenses, but they're normally licensed. And so it's kind of I like to say it's a in between. If you're nervous about having a home birth, or if you want a hospital birth, and a midwife is kind of a good in between because they can provide that. And doula care, so doulas are again doulas are sort of support people. Normally they're in hospital settings, or they can go along with midwives. They're there to just kind of give you emotional support or answer any questions that you might have. I know like a lot of times, especially with natives, we kind of are coerced into taking medications too early, or on the other side of it, maybe not taking any medications because there's a stereotype that Native people don't feel pain as much as other people. So the doula is there to kind of have your back for you, to give you a support during these hard times that can be stressful because it's new, and it might be your first time, and so they've done it before, and so they can be there to help support you with that. And then the fund also covers traditional support. So for traditional support, we're not out there telling you how to do or giving you advice on ceremonies or anything. It's meant there to help. It's there to help support any medicine people within your own community that you have, whether it's for gas money or just maybe fees, just anything to help that traditional person be there to support you. And or either it could be funds for a family meal, or for a naming ceremony if they have that, or compensating someone for cradle boards, like the materials. So it's really it can vary, it can range depending on what your um ceremonies like are there for. So it's just pretty much there to help support your traditional support. So yeah. And then postpartum support. This again include diapers, breast pads, breast pumps, and other items that might make it easier for families to welcome their new additions at home. I know sometimes we might not get the most updated breast pumps or even supplies. So, because I know there's a lot of new things out there now that we didn't have maybe even like 10, 15 years ago. And so just there to any way we can make it easier for the baby to be welcomed into this world, we're there to help. Um, can you go to the next slide? Yeah, thank you. What else are we doing? We help, like I said, we help others understand the complex issues. I mean, in the reproductive health movement, we must include birth because many of the same issues that abortion seekers face are becoming more common for people who choose to continue their pregnancies. I mean, we're seeing in other states where people that are pregnant and they more likely want the baby. Unfortunately, some things happen, and they could have a stillborn. That they might be considered an abortion, and so it's actually leaking over into the other side. And so we just yeah, we want to make sure that we can help understand like how it all connects. we know that, and also we know that when we have a good or bad experience with a provider or at a restaurant, we tell our cousins and aunties and uncles how our birth and pregnancies any different. What we want is we want the people who come to us for assistance to spread the word about our fund and how it can hopefully help them have the birth that they want. And so that goes back into building a strong community with the peers speaking for themselves, because that's really what's gonna really help move any community forward is their own people talking about it. All right, so thank you, and I'll be open for questions later.
Right, so it's my turn, the community health coordinator. Connecting with the community. As the community health coordinator, I am responsible for helping connect community members to resources, whether I meet them while tabling or at a conference or they're my own family members. I want everyone I come across to have all the support they need to make good decisions about their bodies, their own bodies and families. And Native families know what they need. I don't think many of us like it when someone assumes what we need to be healthy, whether it's physical or emotional health. Since we are a sexual health organization and that's what we know, we just want our families to know that they have options no matter what they choose when it comes to sexual and reproductive health. We only offer support and encouragement. We don't want anyone to feel they are not we do not want to feel we don't want anyone to feel pressured to make a decision they're not comfortable making yet. Whether it's because they need more information or they just need more time, everyone learns differently and no one's needs are the same. At the same time, we aim to spread the information so people can hopefully feel empowered to speak up about their needs. Not everyone is comfortable navigating reproductive healthcare. Reproductive health includes sexual health. Sometimes we don't have the words or confidence to ask uncomfortable questions. Sometimes we don't even know where to look for reproductive health care. That's why the word of the mouth is important, and we hope to facilitate. We want to provide tips on how to navigate these complex medical systems. We believe that talking about sexual health helps our young people stay safe. Talking about the taboo subjects helps parents connect better with their children. We want to empower caregivers to use the correct terms for like vagina, for example, and model that for young people and children so we can normalize our changing bodies.
Thank you both so much. We'll get into, I have a few questions for Justin and Ronnie. But here is our contact information. Again, Justin is the Emergence Fund director. So if you have a pregnant person in your life, whether it's a niece, your daughter, your granddaughter, and you're looking for support, uh, to help make sure they have a healthy pregnancy and a good outcome, please email Justin. He can get you the forms that are needed so we can start that intake process. If you want us to present to your organization, your company, or send slides, whatever it may be, Ronnie is the person to go to. And then if you just have like broad questions about the organization, some of the internal things like what's your budget, things like that, you're welcome to email me. We're also on Instagram. We're definitely on Facebook. We're moving away from Twitter/X. I'm sure y'all know why. So you can also find us on Blue Sky. I did not mean to rhyme that. We're on Blue Sky, Threads, kind of, but generally across social media. Please stay in touch with us. So I'll stop there. This first question is for Justin. What states are your clients from, and what does this tell you about midwifery and doula access?
Yeah, I guess by far the most clients we get are from I would say like Arizona, for sure Arizona is probably our leading or it is our leading state, and then but the rest kind of they start to spread out. I mean, but they are in the our central like native population. So like yeah, New Mexico for sure. We got California is a pretty big state that we cover. The Up in the Dakotas, Minnesota or Michigan, Minnesota area. But yeah, it actually it is spread pretty wide though. Arizona, Arizona, Alaska, Texas. We get some for Texas, Oklahoma. So to me, I mean, it just as the fun goes along, it just really shows that that there's I guess that it's spread pretty thin, I guess, not that thin, but like there isn't a lot of representation in midwifery for like Native people. And so it just yeah, it to me it just kind of shows that people, I mean, people ask about it and we talk about it, and so it's there. I see a need for it. People get excited, and I think it's starting to grow. It's growing. We talking with people, there's more people taking classes. I know I was just part of a conference for it's actually centered strictly for native doulas, and so it's picking up pace. But I know it's still a work in progress. But I think that's how it is. Um, the other thing too is that that's true with all midwifery too. It's slowly coming back again, coming back in style, and so but the cool thing is you see all these different places that you didn't know about before, like really yeah, like starting to gain their ground. And like I know here in New Mexico for sure there's birth centers, so that's pretty cool. And Arizona has a good Arizona. So the cool thing about Arizona is they have a good amount of doulas, midwives out there. So it's really and even in I'm gonna shout out to Upa Valley in California. They have some people they can go to, and so it's really encouraging seeing like all these doulas like starting to like get into it again, and like they're actually gaining ground and like making impact with people. And also even just the support of other midwives too is very enlightening too. They they're happy to offer this connection that birthing. So it's it's been very nice talking to different and also I guess seeing different how people view birthing, I guess, and talking about it in different areas. And so it's really nice to see that it's starting to make its way back.
Thanks, Justin. Ronnie, you're pretty new to the org, so how has working with IWR impacted or changed how you view your role as a mom of three? And what have you learned about that has helped you connect more with your kids?
Yeah, I am very new to IWR. I love working with IWR, but working with the org has impacted my role as a mom in a positive way. It has helped me to talk with my children about reproductive health and the choices they have to be safe. What I've learned is that having difficult conversations about reproductive and sexual health has created a strong trust and safe space with my children and my family. Thanks, Ray, for the
Thanks.
question.
Yeah, no, that's really important. That, one of our biggest um, goals at IWR is that our community members are part of this work and that we're compensating them well, because just because we want to make these subjects less taboo doesn't mean that they aren't emotionally hard to talk about. So, yeah, I really like hearing about people's experiences, being in the org and being outside of the org and then now in the org. Justin, is there a space for dads to be involved in birth? And how do you think dads should be supported? Would you mind sharing a little how you might have wanted more support when you became a dad?
Okay, yeah, thank you for the question. Yeah, of course, of course, there's room for dads. They should be the support person, I guess. But also too, just realizing like, I guess communities too, are big support too, and just let's see what else you say. Do you think dads would be more? As in support for dads, I think, I think hopefully, I guess, yeah, just I guess just talking about it too, just talking about like the different things that go on with birthing, and even like small things, like little things, like when the baby's first poop comes, knowing it's gonna be a tardy black, because that's the it's gonna be that initial crazy poop coming through, and so like just like exchanging things like that, and also yeah, like I don't know, but I'm trying to think of other like crazy little tidbits, like yeah, like even like breastfeeding the baby, the poop doesn't stink. And so like when you go to switch the formula, like I don't know, the poop kind of starts to smell a little bit. And so just little things like that. But I guess like what would be nice too is like, yeah, just having that opening that conversation, things like that. And just yeah, and just realize, or letting the other dads know that they can be there to support their partners with the birth, because yeah, because it is an emotional time for a birthing parent, because people like not only are your body changing, but like your emotions are changing as well too, and it can be scary, especially the first time. And so like I guess yeah, just dads understanding that they can play a big part in like helping to um ensure that the parents are like feeling comfortable, or just along with that too. I was very lucky too. I kind of grew up with a big family growing up, and my grandmother was actually the one that kind of I guess destigmatized me, changing diapers and whatnot, because she just like basically it turned into nothing because the baby had to be changed. And so when my kids were born, I kind of already had some of those, I guess, those skills, I guess, because my grandmother already kind of um helped me realize that, like, yeah, it's nothing to change a baby's diaper. And so even like I think it's good too, like for fathers to talk with their grandmothers, or like other people too within their family or community, to and like also learn from them too as well, because it goes a long way with helping dads like be involved too, because I mean I'm sure like I hopefully for them they have a sense of pride too, that they're there, they were there for their child too, and the mothers during this time. I don't know if that answered the question, but yeah.
It doesn't. Just kidding. No, that was really helpful. Thank you. And Ronnie, the last question goes to you. What do you hope people will take away from tonight's webinar?
Yeah, I hope a takeaway from from tonight's webinar is a clear understanding of what the Emerging Fund provides for Native families and the support we offer. And if not, that's okay. Just please reach out to us. We're happy to provide any support, give any information we have to any resources. So email us, please. Thank you.
Yes. Thank you everyone for joining us on a Friday night. Um, I really appreciate it. It's been 11 years of figuring out what works and bringing people together, and just for people showing up tonight and asking questions and listening and being in the chat. It really does mean a lot to all of us. So thank you. Thank you, Justin and Ronnie, and I hope everyone has a good weekend. Bye.
Yes, thank
Thank
you.
you.
Bye.
Yeah.